We're well into an era of exciting new technology. It's in the vehicles we drive, the computers we sit across from, and the device that's likely sitting in your front pocket right now. And with new technology comes new ways to do old things. For some, they might be very keen to try new things, while others might prefer the old way, but regardless, there's choice. Virtual therapy is an excellent example of one of those things. Since 2021, virtual therapy services have increased by 38 times, and it's expected to continue growing at this pace well into 2028. But how do you know if virtual therapy is right for you? Let's look at 5 different factors for consideration. First, I think it's hard to deny the comfort and convenience that comes with virtual therapy. A couple of clicks and you're online and in a session with a therapist. This can occur at home, in an office, or even in a vehicle, provided you're not driving. Essentially anywhere that's private with a secure internet connection. And being able to have a session in a place that's comfortable and familiar can help to reduce the discomfort of walking into an unfamiliar therapist's office for the first time. And thanks to improvements in modern technology, it's helped to address 2 primary concerns that originally existed with virtual therapy. First, there was concern that virtual therapy wouldn't remain confidential if it didn't occur in person. However, with the sophistication of modern-day encryption with apps such as Zoom and Teams, both therapists and clients can feel confident that sessions remain private. Second, it's evident that nonverbal communication is important in psychotherapy, as it not only helps provide valuable feedback, but can help to enhance a feeling of connection, which is important for enhancing trust and promoting success in therapy. With improvements in technology, the ability to see the therapist's face without the screen freezing, as well as hearing their voice clearly, has helped to mimic the experience of in-person therapy. So not surprisingly, we're now seeing studies which show that virtual services can be just as effective as in-person appointments. For my second reason to consider virtual therapy, it provides access to more choice. With traditional in-person therapy, you're essentially restricted by proximity, meaning that you have access to service wherever you can travel to see on a reasonably consistent basis. And this can present challenges with service restriction, especially for those who live in more remote areas. Finding psychotherapy services for common mental health issues that many adults face, such as anxiety and depression, is fairly commonplace. However, finding services for different client populations where there are fewer service providers, such as children, teens, couples, and families, can be more challenging. It's also helpful for clients to have the option to seek service from someone who offers a specific therapeutic modality, such as CBT or DBT, or specializes in an area that isn't as common, such as bipolar disorder. What also makes psychotherapy particularly unique when compared with many other services is that rapport is critical for success. And while this can be difficult to measure, there are studies which show that up to 35% of success in psychotherapy can be attributed to a strong therapeutic alliance between a therapist and a client. This isn't particularly surprising, as good rapport with the therapist can help the client feel more comfortable, more open to engaging in conversation, and more likely to follow through with the therapist's recommendations. So it's vitally important to have a good connection with a therapist, and having more options for choice based on whatever our criteria are important to a client can help to promote that connection. For my third reason concerning virtual therapy, it provides better access to service. And this reason is probably more widespread than most people think. For those who have physical challenges or suffer from a chronic illness, virtual therapy certainly presents an ideal option when there are mobility or health concerns. Virtual services also allow people to attend and maintain therapeutic momentum when there are issues with bad weather or when a client's child is sick. For instance, with someone who works during the day and is unable to get time off work or attend in the evenings due to childcare or vehicle constraints, virtual therapy can be a viable option. Or for some, the time involved to go back out in the evening and travel to and from a therapist's office can lead to someone discontinuing service early due to the large time commitment. Reason number 4, virtual therapy can help with time efficiency. Time is essentially our most valuable commodity, and I can't remember the last time I heard someone complain about having too much time in their hands. So it's definitely helpful to be able to book an appointment that can fit into your life, such as booking an appointment during your lunch hour. It also comes with the convenience and cost savings of not having to drive and find a place to park. Not only that, it also helps have the flexibility to fit into your therapist's schedule, as this could be the difference between having a timely next appointment or waiting longer than you'd like. The reality is that for some, being able to book an appointment that fits into their life may very well be the difference between going to therapy and not going at all. For instance, a single mom with kids might have a window of time from 6 to 7 in the evening before it's time to get your kids ready for bed. If a therapy appointment can't be sandwiched between having supper and getting kids ready for bed, it's not going to happen, especially when there's no time available for travel. And for my fifth and final reason for why you might want to consider virtual therapy is it can provide additional anonymity. With virtual appointments, you won't be seen walking in and out of a mental health clinic, nor do you have to sit in a waiting room with other people. This can also be particularly desirable if someone lives in a small community and doesn't want others to know that they're going to therapy. Another potential benefit of virtual therapy is that people might be more willing to talk about an embarrassing issue that they wouldn't otherwise talk about in person, as there's an option to simply turn off the camera. And for those who are particularly anxious, starting with a virtual appointment might also serve as a bridge, at least to future appointments, where there's video and potentially an appointment in person, if that's an option, as feelings of comfort increase and anxiety decreases. So to provide a quick recap, the first factor to consider with virtual therapy is that it provides an opportunity to have sessions in a place that's comfortable and familiar. These appointments can essentially occur anywhere that's private and has a secure internet connection. Second, virtual therapy offers more choice. With traditional in-person therapy, you're restricted by who you're able to travel to see in person. With virtual therapy, you can select someone based on any criteria that's important to you. Third, virtual therapy offers better accessibility to therapy services for everyone. This can range from people with physical challenges and chronic illnesses to people who are simply battling a cold or in a situation where transportation presents as a barrier to service. Fourth, virtual therapy offers better time efficiency. Time is our most valuable commodity, and it helps to be able to book an appointment that can fit into your life or can help to expedite a timely follow-up appointment. And for my fifth and final factor to consider, virtual therapy helps provide greater anonymity. With virtual appointments, you won't be seen walking in and out of a mental health clinic, nor do you have to sit in a waiting room with other people. So I hope you found these factors to consider about virtual therapy to be helpful. If you're interested in learning more about virtual therapy or pursuing virtual therapy services in Ontario, Canada, please feel free to contact us at Sullivan Associates Clinical Psychology. If you enjoyed the video, like it, share it, and subscribe to the channel. Thank you for watching.